Hi, I'm Donna Davis. I am here with Dr. Sanjay Patel of Cobb Center for Advanced Dentistry and Human Noorparvar, a physical therapist from Advanced Rehabilitation. And welcome to the show. We're glad you're here today to tell us all about TMJ.
Thank you for having us, Donna.
Very happy to be here. Thank you.
Yes, so both of these healthcare professionals really have studied TMJ. It is a specialty for them, and we want to be able to answer your questions today. We're going to talk about some of the symptoms, the latest treatments, some of the consequences if you don't seek treatment, which is so important in this. I don't know if you call it a disorder, but it can actually cause damage in your body, and it can also just be quite annoying. So we want to welcome all of you to the show. We're glad you're here, and we want to talk about a few things with it. First of all, let's take a look at a video that Dr. Patel furnished us.
At Cobb Center for Advanced Dentistry, we believe it's how you bite. Headaches, migraines, ear pain, vertigo, TM joint pain, or other jaw problems could be related to the way you bite. Correctly aligning your bite fixes a major contributor to migraines, headaches, and jaw pain without the long-term side effects of prescription drugs and creates a beautiful smile. Visit us online or schedule your appointment today at Cobb Center for Advanced Dentistry, where we believe it's how you bite.
It's all about how you bite. And when you're not biting in the right way, it's really uncomfortable. I'm a TMJ patient myself. I met both of these wonderful healthcare providers who have helped me so much, and we hope to help you as well. Dr. Patel, first of all, let's talk about some of the symptoms.
So, Donna, some of the symptoms of TMJ is headaches, tension headaches, migraine headaches, ear congestion. Part of that is just because of the inflammation caused by TMD. Some patients will get episodes of vertigo, dizziness. They may be walking along and just bump up against the wall, or they feel dizzy. Sometimes they'll get ringing in the ears. Sometimes patients come in with neck pain, neck discomfort, thinking that, it's just I'm working at a computer, or that's I carry a lot of tension around and things like that. Whereas it's just because if the bite is off, the neck muscles have to work harder, and that's why they have this discomfort and stuff. So there's a very um, symptomology that TMD presents as, and I could give you a whole list, but what we do is kind of try to work on figuring it out, what's causing it, and then see if we can treat it and get them healthier and with pain.
Right. There are so many different symptoms that you can have, and you might think that something else is causing the problem, but there's a lot of stress when your jaw muscle has to work that hard. Human, tell me a little bit about some of the symptoms that you see with patients coming to you and what physical therapy can do for them.
Yeah, absolutely. So, as Dr. Patel alluded to, there's a lot of indirect symptoms. So, if you end up in my office, a lot of times an ENT has checked you because you went to them thinking there was something wrong with your inner ear, or you went to a dentist because you thought there was an abscess tooth or something going on with your mouth, when really the issue lies in the TMJ itself. So, there are some direct symptoms, of course, of jaw clicking and popping. But what we often see is there is going to be dysfunction of movement somewhere. There's usually going to be strain on a lot of your postural muscles. So the muscles that hold up your torso, that hold up your neck and head in the right position. And then some of those more direct symptoms might be issues with your bite. So you have issues clenching, or your teeth don't meet, or sometimes your mouth doesn't open. And so where physical therapy comes in is we create this problem list where we try to identify as many characteristics of dysfunction, meaning muscles or joints that are not moving normally or appropriately. And then we try to intervene on them. So some of this might be muscle spasms or tension in muscles of mastication, range of motion of the neck, and some of the muscles that control posture, and intervene on them directly. So we'll go ahead and implement a strengthening or stretching program where appropriate. And then some of the more direct treatments we provide is manual therapy. So if there is a muscle tension issue or muscle spasm, we might use a technique called dry needling, which is a very effective tool for trigger point release. Manual therapy, where we use our hands as instruments to try to break down this tension. And then we'll even use modalities such as the low-level laser therapy, which has been proven to really reduce pain and inflammation directly in soft tissue or the TMJ joint itself. So there's indirect treatment and indirect treatment. It just depends on where we're finding a lot of these issues on a patient-by-patient basis. So, we have to look at the patient as a whole rather than just having tunnel vision right in the TMJ itself.
So I know you've got something there with you that you use a treatment, right? Explain that, like how you
Okay.
use that to get the muscles to relax.
So what I have right here, and it's very hard to see because that's how small it is a single dry needle. So if we look at it, it's pretty thin. In fact, my needle probably fits in the hole of the shot they use to give you a flu vaccine. But the idea of this is it's going to produce what's called a twitch response on any muscle that has a tension trigger point in it. So if you have a muscle that has a knot in it, that's the layman term. We'll actually insert this needle into that trigger point, and there's a reflexive response that occurs that forces that muscle to release. So this could be muscles of mastication. It could be muscles that control your neck posture. So a lot of times what we'll see is patients who suffer from TMD often have a forward head posture. So the head is drawn forward. So these muscles on the backside end up overworking, being overstretched, and as a result of that, they'll form these trigger points. So we'll insert some of those needles into those trigger points, causing it to release to really amplify the effect of that. Sometimes we'll leave those needles in the soft tissue for several minutes, and then we'll stimulate those needles to actually produce fatigue. So we're essentially down regulating how much tension is occurring in those muscles. So I use a TENS unit just like this, which has alligator clamps. So it's like you're jumping a car, but it's all going through that needle into that muscle to relax it. So the idea is too much tension may be bad. Overstretched muscles might be bad. So it just depends on what the issue is. So dry needling, one of our most effective tools for treating this disorder.
Right. I can say that it definitely does work. And it's funny, Human, when you had the needle that close, it looks really big, but it's tiny. You're right. And after you put it in and get that initial response, you don't even feel it.
Right.
So it looks much worse than it is.
And it sounds a lot worse than it is.
It does.
But it's highly effective.
Yes, it is very effective, and the relief is so worth it. So, Dr. Patel, tell me about some of the treatment options that you offer.
So where we come in, and we work synergistically. What we have found over time is that why patients have TMJ is because of the bite. What it is essentially, in order for us to swallow, our teeth need to touch. Essentially, your jaw muscles then have to work extremely hard to maintain that posture. So every time we swallow, we're only expending a minimal amount of it. Now, if you can picture, if I walked in and hand you a 20-pound dumbbell and said, hold it in your arm, how long will your arm be able to hold it without getting tired? Not long. Because that muscle then gets fatigued, it starts recruiting muscles from the rest of the head and neck. So where we come in is, we go in and try and figure out where is the bite in its most harmonious relationship with those muscles and the joint. So when we figure out where your bite is, it's pretty easy with patients come in and they're like, oh wow, better. I'm feeling less pain, less discomfort. And one of the symptoms that you didn't even realize was, I remember you came in and said, Dr. Patel, I have more saliva in my mouth now, whereas before you didn't.
Right. That was very helpful. And let's take a look
Yeah.
at some of the pictures that you show how you get people to relax their jaw so that you can make the orthotic.
Right. So this is pretty much a TENS unit and a EMG machine that we use to, number one, record muscle activity, figure out what's going on when you're biting and closing. Ours actually is an ultra low frequency TENS machine, and what it does, it works on the muscles of the jaw and the neck to get them to relax. So we usually have patients on these TENS machines for about 45 minutes or so. Most of the time, I have patients get on the TENS and they fall asleep. And that's my whole goal is I want to get you and your muscles as relaxed as we can. Then I can go in and I use the TENS machine to essentially give us what we call a left, right, front, back, all that other stuff. So what we are doing is actually getting the muscles to dictate where your jaw wants to be in its most comfortable position. Um, then that's the step. That's where I take a bite. And then I send that off and essentially we fabricate an orthotic. Basically, an orthotic is just phase one treatment. What this does is it occupies space, essentially reestablishing the bite and letting the muscles heal on their own. The reason I do this step is because I can go in and make adjustments on this orthotic, and adjustments are going to be needed because as your bite changes, your posture is going to change. And as your posture changes, your bite changes. After we have a patient on this orthotic for about a week, we have you come in um, and then let you go for another month, go back in, readjust the bite. After that, it's okay. How do we hold this bite long term? And that's where we will discuss phase two treatment, maintain this bite long term without having to wear an orthotic.
Right, but I will say that the orthotic does give immediate relief. And even with it, there are patients, I know I'm not the only one, who feel like you really need to go back and get the physical therapy that helps your muscles relax and go into place better. It just works better. So, Human, you do have patients who come back to you, right, as they get treatments from Dr. Patel.
Right. So, the relationship, I think, between Dr. Patel's treatment and where a physical therapist like myself would come in is, you know, when I was describing before, there can be a whole host of problems on that problems list we're creating. There's probably a source of that issue, and I think he is essentially narrowing down the source of the problem, which would be how you bite. So, in adjusting that bite, there are side effects, and there is strain in new areas of the body, and that can be somewhat uncomfortable in different parts of your body. So, my job would be to come in and try to reduce as much muscle guarding or muscle tension as possible. And in addition, um, you know, for him to fabricate that orthotic, sometimes it's difficult if they have really poor posture or excessive what we call kyphosis of the thoracic spine, which is rounding of the back, or lordosis of the cervical spine, which would be that reverse rounding of the neck. So my job would be to try to come in and reduce and manage that the best I can in order to improve their prognosis for what Dr. Patel is performing.
Right. So, also, Human, tell me how you got interested in this. I didn't even know that physical therapists ever did this. So, what kind of training did you have, and why did you get interested in it?
It's a great question. Physical therapy now is a doctorate program, so it is long and rigorous. And in that education, they provide some degree of TMJ treatment knowledge, and it's in the curriculum, but it's really superficial. And so, you might see one patient a year that just trickles through the door, and you try to do the basic things they teach you. So at the time, I was working in Athens, Georgia. Um, most notably known for the University of Georgia down there, but I was treating patients, and I'd see one or two come in and realize that a dentist sent them over to me only because they didn't really know what to do for them. And I'll let Dr. Patel speak to this a little bit, but it seemed like the go-to answer for the dentist who really didn't want to treat TMJ was just to sell them a mouth guard, which wasn't really intentional at all, other than trying to protect the enamel from people who grind their teeth, what we call bruxism. And so what I found was this void in knowledge for therapists to treat these patients as well. And so I just started diving into continuing education, and learning different treatment modalities and techniques to try to help the patient population. And the more I met with dentists in the area, the more I realized they were more than thrilled to find someone to give them more than just, hey, we only give our patients a mouth guard. There's more to the treatment of TMJ. So that's how I got involved. It was just more of there was a need for it, and I was happy to fill that void.
Yeah. Well, you do a great job. I can certainly say that myself from experience. And Dr. Patel, how did you get into this as a specialty?
I got into it in two ways. One was, and like as exactly as Umar said, even though they had limited exposure to it in PT, it's the same thing in dental school. We had limited exposure to TMJ. I still clearly remember I was in dental school and, we were making dentures. And it's like, where do we determine where a patient who has no teeth, where do we determine where the bite goes? You have a sore knee, there's something wrong with your joint. You have a sore hip, there's something wrong with the joint. So it didn't make much sense to me. The other way I got into it was because I do implant dentistry. When I was doing full mouth implant rehabilitations, essentially, I had to figure out where does this bite go? Because when you do implant dentistry, there's a lot of biomechanics involved. And the weak point in implant dentistry is not the implant, it's not the teeth, it's not the tooth itself or anything like that. It's actually the bone because an implant is titanium. Bone is the soft thing. So if the bite is off, the implant's going to fail because the bone is going to fail. So when I started looking into different treatments of bite modality, trying to figure out, okay, where do I figure out how a patient bites? I started researching theories as far as you know how people bite go. And I ended up I found out about this neuromuscular dentistry. And I attended some courses and I said, okay, this makes a lot of sense to me, just common sense, that the reason patients have these issues is because the muscles are overworking. And so I started investing a lot of time into going through it. And the thing with neuromuscular dentistry is it's like a bunch of wormholes. Once you get into something, it just keeps going and going and going. As we learn more stuff, we just keep learning more and more and more.
And I do think that it's a very difficult, complex joint, and there's not enough research. And I think we've hit just the smallest amount of, there's not that many people treating it. I know when I went to ENTs, they didn't seem to know much about it. And because of the division with dentistry and doctors and that kind of thing, I think it's just one of those things that's very difficult to treat. So thank goodness there are healthcare professionals like the two of you who've taken an interest in it, and I know have helped so many people. I do want to go back to Human. Tell me a little bit about why somebody might want to go ahead and seek treatment and not just wait. Like, I literally thought for a couple of years, oh, it'll go back. I don't need treatment. It'll just get back into place. But tell me why that's not a good approach to take.
Typically, the body should begin healing itself, and if it doesn't, that's where we come in and try to put the body in that environment. So if you're constantly struggling with some of the symptoms we've described, whether it's directly related to the jaw or not, it's your body telling us that something's wrong, and it's only a matter of time before that strain starts elevating and progressing into something that might be structural. So, for example, your TMJ, your jaw joint, it has a disc inside of it, and that disc can't wear down if the bite is off. For protecting the longevity of your jaw, very important. Typically, from our experience, if you do let it go and continue, and you just put up with it, those symptoms will start to evolve into something a little more dysfunctional, and so. It can progress to a migraine headache, which is debilitating. It can progress into a host of other issues that involve the neck and the discs that are involved in the neck and some of the muscles that surround that area as well. So it's very important whether your issue is a neck issue or a jaw issue to address it, because one way or another it will evolve and worsen. And so it's all about just improving the quality of life and improving the longevity of all the joints you have, whether it's in the jaw or the neck.
Right. And Dr. Patel, tell me about that as well. I know when you showed me my dental x-ray and you said, don't you see that? I don't look at dental x-rays, so I didn't notice, but you showed me how I had bone loss. And that's a really scary thing. So tell me a little bit about that in the patients that you see. Do you see bone loss?
Yes, so typically what I do see is up in the joint area, I do see bone loss and, changing of the joint itself. And that's because, form follows function. So if you're functioning in a bad bite, your jaw and the muscles are going to basically try to accommodate that bite. Um, And so what we end up usually seeing is the joint itself starts resorbing or changing shape. One of the terms we call is beaking of the joint. And essentially what happens is where the lower jaw joint fits into the upper joint, it starts wearing down and you essentially have what we call almost like a bird beak or beaking of the joint. As Oman was alluding to earlier, the disc itself, if you're pounding on the disc, essentially you get deformation of the disc. And so what happens is your jaw opens, the disc rides forward and locks the patient in position. A lot of physicians tend to just say, okay, we have this symptom, we're just going to throw drugs at it. All those medications are doing is treating the symptom. Long term, what are those side effects?
Well, thank you both so much for being here today. We are almost out of time. I have to say personally that you're both correct that you just improve your quality of life so much. Every day my jaw would ache. I did have issues with dry mouth. Things aren't perfect now, but they are 100 times better than what I thought that they could be. I didn't hold out a whole lot of hope. Did a little research online and nothing looked really promising, but both of you and the treatment that you've given me has been fantastic. So I really am glad that we did this today as a public service, and I would just want to thank you both and hope that and encourage people that if you're having issues with this to go ahead and seek treatment from either one of these professionals. You'll be in great hands.